Good afternoon and welcome to today's webinar presented by the International Association of Fire Chiefs and First Due Pre-Planning. Thanks everyone for joining. My name is Jeff Dillon with International Association of Fire Chiefs, and I'll be your MC today to go through and introduce our speakers. And then at the end, we'll have several amount of time for you to ask questions. We will not be opening up the mics. However, you can type your questions in the chat bar at the bottom of your screen, and then we will field those questions at the end of today's presentation. At this time, I'd like to present Mr. Rami El-choufani, Head of Product Development for First Due Pre-Plan, and he's going to walk us through today's webinar. Rami, take it over.
Thank you so much, Jeff. And hey, everyone. For those of you who don't know me, I'm the Head of Product over at First Due. I'm going to give you a bit of a background around First Due and Community Connect and what this initiative actually is in just a moment. But to give a little bit of an introduction to this concept. So about 3 weeks ago, 3.5 weeks ago, we started to receive some feedback from our customers that these times were becoming quite challenging, especially as related to everything happening with COVID-19. But also everything around responding to regular incidents, people with high risk and access and functional needs, all the general challenges that public safety agencies across the country have were being multiplied because of the COVID-19 pandemic. So we kind of put our heads together with the IAFC, with technology partners like Esri, and really quickly put together a platform, a self-reporting platform that was going to be available to public safety agencies at no cost. This is quickly becoming the largest infrastructure around self-reporting from a public safety operational perspective, not only in the US, but we're hoping across the planet as we're starting to release the international components of the solution as well. It's an incredibly crucial part of this fight against COVID-19, and we're really excited to share it with you today. So what we're gonna do today is kind of walk through a background on First Due, just to give you a sense of who we are and how we started this initiative. As part of that, we'll talk about a little bit of intro to Community Connect for COVID-19. From there, we'll jump straight into how it works. So we'll go into a bit of a demo. How do we get access? So if I'm a public safety agency, how do I access the responder view? How does a resident then go ahead and sign up? What's the sign up process look like from a resident perspective? And then taking us back to public safety, once people start to add data, how do I access that information and data as a public safety agency, as a first responder? And then the kind of final piece is, how do we actually spread the word? So how do we get this information out to our residents? So we're going to talk through all the things that we provide to you to really quickly get those social posts out, get your press release out. It's a very, very simple process. So we essentially, there's nothing for you guys to do apart from a couple of social posts, put out a press release. We give you all the content that you could possibly need to get this out to your community and to start to get them to actually self-report. And then we're going to finish up with Dan Flynn, who's a division chief over at the city of Asheville. Dan is just a great person to walk us through how they adopt and rolled out Community Connect at their agency and how they're starting to push their residents to self-report COVID-related information through Community Connect as well. So why not just start with a little bit of intro on First Due? Our mission at First Due from the beginning has always been to protect the lives of first responders and the communities they serve by bridging this deadly information gap that's always existed. And the way we did that is we built this really comprehensive pre-incident planning platform and mobile response platform that connected into a bunch of data sources to give you pre-plans on every structure from day one, gave you this amazing planning tool to go and collect additional information, and then kind of rounded that up in a mobile response tool. But the most important part for this discussion is the engage piece, which is a Community Connect, allowing residents to log in, or discover, a secure profile, log into that secure profile and provide critical information from access and functional needs to household info access and utilities, a whole bunch of different information that they can provide to you so that that information is available to you when you're responding to an incident, all just integrated right into the pre-plan. Now, we obviously noticed that Community Connect being something that was rolled out across the country already. Agencies such as Fort Lauderdale, City of Asheville, all of Buncombe County. There was, all of Kitsap County and Pierce County as well, rolling out Community Connect to their residents already. We realized that this was a really great tool for us to say, hey, why don't we build another version of Community Connect, a simplified free version that we can just roll out to the entire country to try and help kind of win this battle, or at least take the pressure off for public safety agencies. And this is something very close to us. We're hearing more and more stories within our own First Do family of people being impacted, even just today. So we really shifted our focus to seeing how we can help during this time of crisis. So all of our resources, most of our employees are focused on ways to get this solution out. And the solution is really straightforward. It allows you to sign up, create a profile, and that data is available to you guys from a response perspective. So what we're actually going to do now is walk you through kind of that end-to-end workflow. So we're going to start on the public safety side, just going to show you how you quickly sign up, move over to the resident, walk through the resident sign-up process, and then we're going to go back into the public safety side to show you how you actually how you're able to see the data from a response perspective. So let's just jump into the demo. Right. So as you can see on my screen over here, I have firstdosizeup.com/communityconnect/COVID-19. This link will be available to you guys. You can go to it right now. We'll also send it to you after the webinar. It's a simple landing page where you can come in, scroll down, and just gather some more information about what this is from a public safety agency perspective. So this is actually your public safety agency information page and sign up page. So it's not for residents. We're going to talk about the resident page in a second. It shows you that all you do is you've got to push a certain link to your residents, which we're going to go through in a second. Residents sign up, and that information data is available to you guys from a response and analysis perspective, all within ArcGIS, within the First Do platform. And getting started is really straightforward. All you do is fill out the form below. So over here, fill out this form. You'll receive credentials and a welcome email. And that welcome email is going to essentially tell you how to get started. So all you need to do as a public safety agency is come over here, fill out this form, and create a free account. One thing to note is when you do create a free account, please use your agency or city email. We, from a security perspective, are very focused on keeping this login for public safety agencies, so please do that. Within 24 hours, you should receive your login. So once you've done that, what will happen is you'll actually receive this welcome email. This welcome email does two things. It gives you access to the public safety user side, lets you reset your password, and gives you a bunch of FAQs and kind of shows you this step-by-step. So you can. It also tells you, how do I now get my community to self-report, right? Because you might not see many of those map markers that show people self-reporting in your area. This kind of walks you through a step-by-step guide for that. So it tells you to share it internally, share the resident landing page, post this link on Facebook with example bits of copy. So we make it really, really easy for you guys to get some of those social posts out. And let me just kind of give you a step-by-step guide. I'm going to walk through all of this at the end, but it can be as simple or as complex as you like. If you have your own kind of internal marketing team, or your PIO can just be getting this information out in a simple post. And again, we're going to show you an example of how all that works. But the most important part to this is this resident-facing landing page. So I'm just going to take you over to show you what that looks like. This is the initial information page for your resident. So you're going to share this link on your social media profiles. You're going to be pushing out saying, hey, everyone, we're using this great new tool to allow you to self-report critical COVID-related information, which is going to include a bunch of different types of data, not just whether they've tested positive to COVID. There's a couple other things we're going to show you in a second. And residents can scroll down. They can get a sense of why they need to do this, how easy it is to do, and then also who should self-report. So this is a really crucial part. We're pushing everyone to self-report, even those who may or may not have tested positive or may not have symptoms. Definitely people who are high risk, and we're going to show you some of the options that people can select. We definitely see, in terms of the people that are going out and self-reporting, I would say a good chunk are actually people who are high risk but do not yet have symptoms. So knowing where that high risk or at-risk population are located can be really important for you guys. And then obviously having contact details for them as well. And then just making them comfortable that the data is secure and it's used just for the purposes of helping during this crisis. This is something that we're doing as with our friends in public safety, with our partners in public safety, to really just find a solution to some of the biggest challenges that we're facing at this time. So resident will read through that. They'll say, hey, yes, I'm comfortable. And they'll click, yep, self-report status. And it's just going to send them to a registration page. In a few seconds, they'll be able to put in their email, put in a username and password. It will then take them to a page where if they would like to, they can put in a name and phone number, but they don't need to at all. It can be completely anonymous, but they will need to put in an address. Once they put in the address, they'll just be taken straight in and they'll be able to register. I've actually already created an account, so I'm just going to click sign in here. Perfect. So now I've signed into the account. And as you can see, this is a little bit different than the one that you saw earlier, because this is the simplified COVID-19 specific Community Connect for agencies across the country to push their residents at no cost right now. So you can see I've got my personal information. So if I wanted to edit, just info related to me, I can. Or I can come in and submit the COVID form. I can log in at any time to update this information, and we'll talk about that in a moment. I click edit. This form is a form that we've actually put together, working with the IAFC, working with partners like Esri, by reviewing information from the CDC, World Health Organization, just looking through a bunch of different standards and putting together, and then listening to our customers and putting together a form that really helps get a good understanding of your residents, your community, and the public. First thing we're going to ask is, where exactly are you living? Single family, apartment, assisted living, healthcare facility, other. So in my case, I'm obviously in an apartment, but if you're in an assisted living or healthcare facility, you can register your entire healthcare facility here. I'll click apartment. Let's say we have 2 people here. I can put as many as any kind of integer in there. First question it's going to ask me is, anyone in your household considered to be high risk for COVID-19 or have access and functional needs, right? So it's more than just COVID related. So if I come in here, I can say, someone can be immune compromised or, confined to bed. And we got a request to add autism from one of our free account users. And we actually added autism in as well. So if there's some things that you'd like to add, we can add them in as also. And this is all about the household level. Does anyone in the household have any of these conditions that we need to be concerned about? And then some additional information. On the COVID side, really simple questions. 1, have you tested positive? So, and obviously in my household, no. Within the last 14 days, has anyone experienced COVID-like symptoms, right? So, and have not been able to get tested? Yes or no. Has anyone in this household had close contact with anyone who's tested positive? Yes or no, right? So it's just about getting an understanding if there's potential risk here. And then the final question is anyone in isolation or quarantine? And then just gives those definitions so people can understand what isolation and quarantine actually mean. So this form is really simple to fill out, takes a minute to do. it's one form for the address and for the household, which is really crucial, right? Because data at the household level is more important often than the individual. And then if I press save, that's updated that form, and that data just flows through to the response side of things. So what we're going to do now is actually move over to the responder view. So I'm just going to come back over here, and we're going to jump into the responder view. So you'll get login credentials, and you'll be able to really quickly log in to the First Do application, which will, it's a limited version of the application. Doesn't include a bunch of the features that if you do know First Do, they just won't be part of it unless you're an existing customer. But you'll have access to a map. You'll have access to the data that's being collected. Now, this is a United States view. We will be migrating to a statewide account. So, for example, if you're in the state of California, that data will be limited just to the state of California. And there's obviously a couple of reasons for that, but we'll be migrating to that approach. And then we also will be releasing, Canada, UK, Australia, and then by the end of the week, anyone across the world will actually be able to report using Community Connect, and any first response agency will be able to access data in their own country and their own country only. So just some exciting news there around the access to this first response platform. And again, all at no cost to public safety agencies. So what I'm going to do, I can come up here and actually search. So if I typed in New York over here, I'm going to zoom me in on the New York area. And so what we have here is a bunch of people that are self-reporting. Blue refers to people who are at risk or high risk. Green are people that are healthy. Red or orange, which we actually can see in some other areas. Red actually means that they're tested positive and currently in that 14-day window. And orange is that they're symptomatic, have not been tested, but again within that 14-day window. Gray just means that they've recovered from whether it's COVID or just symptoms, so it's been past that 14-day period as well. As I zoom in to the map and just come over here, if I click on one of these, you can see here this is actually a profile that someone's filled out. It's actually one of our employees, and it's an apartment. 3 people live there, and yes, there is someone who's has immune compromised, and it's because they're pregnant. And here's some additional information of someone actually being in contact with someone who potentially had COVID-19 but not exhibiting symptoms yet. So you can kind of click to see detail, or you can see information from a map perspective. As you can see that we've got people self-reporting across the country, and we'll kind of talk about how that is working. The big clusters are where agencies have actually started to release this out to the public. And again, we'll talk about that in just a moment. The other concept which is interesting here is you can come across and click on the layers on the left-hand side, and you can see Johns Hopkins case data overlaid onto the map, right? So you can start to see that data as well. And if you wanted to zoom in a little bit closer, we can also throw in a couple more layers that are just, they're actually coming from the Department of Health and Human Services. Turn a couple of those on, which are just nursing homes and hospitals. So you have access to those layers. They're publicly available layers that we're just putting into your account to make things a little bit easier for you and trying to make the solution a little bit more valuable from a day-to-day perspective. So once residents start signing in your jurisdiction, start creating profiles, you may actually see people that have already done this, because we are also doing our own national release, which we'll talk about in just a moment. So I guess the question is, how do we get people to actually release, or sign up? So let me just jump over here. Second, back into this presentation. How do we get the word out? So as part of that welcome email, we give you a step-by-step guide, and we'll actually send you this presentation as well. First step is to share internally. So we give you a landing page, send this around to people internally, your organization, just so that they know what's going on. Step 2 is to share the resident landing page, the one that we went through a little bit earlier, and here's the URL for it. You want to get this resident landing page out to people, and how do we do that? We post it to social media is probably one of the first things you do. If you have mailing lists, you can mail it out. There's a couple of other options which we'll talk about in a second. But from a social media perspective, you just copy and paste that link into your social, and we even give you some copy that you can use if you don't know what to write. But you might have your own processes there. Just make sure to always hashtag self-report. A lot of agencies are doing that. And here are some examples of some of those agencies. So we have the City of Draper, posted some great stuff. We've got agencies across the country pushing out some great content. Central Kitsap, Kitsap County in general, doing some great things, and a lot of the agencies in Washington State pushing out their press releases. We have a lot more over the last week that have just been prepping for their own release. So that's really exciting. And then just a bunch of existing customers that we're getting their release out of Community Connect, and that's why you can see a lot more self-reporting happening across the country. Next thing you can do is display it on your own agency website. Just put a Community Connect logo or some sort of link to say, hey guys, you can self-report here. Definitely reach out to local news. We are doing that as well. But here are some examples of Eastside Fire and Rescue, Fort Lauderdale, City of Asheville doing a great job reaching out to the press. You can just simply send them a press release to get them excited. Reach out to your local groups and organizations, also a great way to raise awareness. And again, this is all really simple, easy things to do just to drive people to that landing page. And then finally, we give you a bunch of different flyers, things you can print out, put your logo on, and you can hand out to people during calls. You can hand out to healthcare facilities. It has a little QR code on it. Take a photo of it, takes you straight to the landing page. Great. And then finally, you can ask our team at any time. You can come to us and ask us, anything you need to kind of help facilitate from a marketing perspective. And in terms of getting the word out, something that's really beneficial is that it's not just you guys. We are releasing Community Connect on a national level. We're investing in marketing. We have some great techniques in which we can drive people to that landing page and get people to start self-reporting now. So we're kind of trying as hard as we can to make some of these things go viral. And as part of that, we are having influencers register with Community Connect and push this out. We have received a ton of great feedback from many influencers in different types of communities, including health and medical world, and we're reaching out to them to have them post because obviously this is a great thing that's helping first responders. So we have a lot of excited people who are willing to get this out. We'll be reaching out to press. We'll be reaching out to some local groups and contacts this week, and we should see a ton more self-reporting happening without you guys even doing anything, which is great. But obviously, you're part of that journey as well. So before we kind of jump into the questions, what I would love to do is kind of just hand over to Dan Flynn, who's the division chief over at the City of Asheville. Really long time. He was actually one of the first people to ever see Community Connect when we built it, and he's going to give you a little bit of a story of how it all got started and then how it kind of this has transitioned into COVID-19. And he'll just have a bunch of great feedback in terms of the best way to roll things out when you see signups, how you can take advantage of different tools to get residents to sign up. So Dan, I'm just going to mute myself and you can go ahead and take over for a minute.
Hey everybody, again, my name is Dan Flynn with the City of Asheville Fire Department. We're in Asheville, the mountains of North Carolina. The folks at First Do wanted me to chat a little bit about my experience with them and how we work together to develop Community Connects. We've been using the platform for First Due platform for several years now. And then Community Connect, when we developed it, we've been using it for a couple years. And one of the biggest benefits that we have is we have our county, the county that we live in, Buncombe County, just rolled out Community Connect and First Due as a whole. So just to kind of the goosebump stuff that is we've got 20 fire departments, including the municipality, that all respond together, and we can have access to everybody's pre-plans. It's a pretty amazing thing. Just to give you a little bit of background on Community Connect, a couple years ago during Autism Awareness Month, I was in a meeting and we were kind of rolling around ideas, and I thought, well, how neat would it be if, or what positive effect could we be if a family who had an autistic member could give some information to the fire department before they got there to just give some idea of maybe what the family member's sense of normal is, what might trigger them, what to do if they were triggered. A lot of that background information that we could gather on the way to the call. So talked to Kevin at First Due. They started discussing Community Connect, and the rest is really history. They built out, like you saw in the slide, they built out basically a way to self-report or to self-pre-plan your residence. It asks questions about where the bedroom locations are, such. So for us, it's a really neat tool. But again, as you saw, now First Due has adapted Community Connect so that it includes COVID-related information. And I wanted to talk. We are a First Due customer, so we have a little bit more of a blown-out version. But it really is incredible. Excuse me. First Due, they really give you everything you need to roll it out. I was lucky enough to work with our PIO. We personalized some of the content to the city of Asheville and sent it out. We sent out press releases. I was able to do our county. I'm sure, like most of you are, our county is doing kind of a briefing, a weekly press briefing, 1 or 2 times a week. I was able to participate in that. And it's just, again, it's not just about COVID related cases. It's about folks with functional needs. A really great example of this that happened yesterday during the press release, or the press conference, excuse me, there was a sign language interpreter. And that was the perfect opportunity to show what Community Connect can do, that you can make firefighters aware that there is a hearing impaired person potentially living in that residence. And so that on the way to the call, you can begin to make arrangements for communication, even if that's just bringing in a notepad and a pen. It's just the uses are really endless. But anyway, this is a great opportunity for agencies just, not only to battle COVID-19, but to build a relationship with the community and the residents. This has really brought the city of Asheville and the county together as we've partnered through this plan. We've partnered through this rollout. And so rather than just the city, we've been able to harness all the muscle of the county PIO and the city PIO, and then just really roll out as a unified effort. People are very receptive at this time. We wanted to push it out. Of course, our agenda is bigger. COVID-19 is the sprint for us. And as far as Community Connect, what we really wanted to do is push out Community Connect for the marathon, so that once this is over, people are actively engaged in Community Connect to let us know things about their houses. Like I said, bedroom locations, utilities, utility shutoffs, are there pets we need to be concerned about? So, and I'll just put out there, if anybody needs any information, I'm glad to be a resource. Until my capacity doesn't allow that anymore. But at this point, I would be glad to answer any questions about how Community Connect personally works for me. So that's about all I've got.
Dan, thank you so much. That was a really good run through, and it's definitely been a pleasure working with you and the Asheville team. Getting Community Connect rolled out. One thing kind of to note. Rolling out Community Connect, especially as related to COVID, is something that can happen very quickly for your agency. So, as soon as you get that welcome email, we're going to reach out to you guys. We're going to send you everything you kind of need to get started. and releasing this out to your own community is really straightforward and simple, and we kind of give you everything you need from that perspective. These are the two main links. If you decide to create a Community Connect profile, please use your personal email, because you can't use, we won't be able to create an account with your first responder view. So just one thing we've learned over the last week as we've been creating agency logins. We have hundreds of agencies that have signed up and have access to this information data, and many of those have already begun to roll this out to their communities. So this is going to be a really, really amazing, exciting way to battle not only COVID-19, but some of the impacts or other impacts of COVID-19 that we're not even thinking about. This is not something that's going to be over in a few days. So we just want to build the infrastructure so that all of you can stay safe and be better prepared for incidents. So that's kind of it from the bulk of the presentation. Happy to, Jeff, if you want to mediate or run through questions, happy to do that now.
Yep. So if you've got questions, just type them into the chat bar there. We've got some we've already got. So we'll start off with, Rami, do you have a defined piece of literature or something that a department can take and put their logo on it and then send it out to their community or post it or things like that?
Yeah, absolutely. Yeah, we have a resident-facing press release that we will send over to you in a Word doc that you can modify, edit, take anything out you'd like to, and then just put your logo on and then just push it out as your own press release. We can show you some examples of that some other agencies have done as well.
Okay, great. And we have one just come in just before we get too far from it is, can you repeat the statement just said about regarding your personal email, not using it or your department email?
Yeah, totally. So there's two links here. One of them is for the Community Connect, the resident-facing profile. So if you actually, if you're a public safety agency, this first link over here is where you will go to request a public safety agency account. For the public safety agency side, please use your city or public safety agency email, because that's what will give you responder access to. If you also decide that you actually want to fill out a resident profile for your own household, that's totally fine. Just use your personal email. If you happen to mix them up, not a problem at all. We're just going to email you and ask you for a personal one, and we'll change it all for you. So if any of that is confusing, don't worry about it. We'll sort it out on the email creation. Anyways, just make sure to come to this first link up here. If you're a public safety agency and you want access, click that link or put into your URL, and then just fill out the form, and we'll take the rest on for you.
Great. Our next question is, can you feed this service directly into a CAD and have it pop up like a fire hydrant layer or another feature service that your CAD populates now?
Absolutely. If you have a GIS team or you have your own ArcGIS account with Esri, we can provide you. We'll provide you access to the layer as like a feature service, and it's up to you guys what you want to do with it. So you can distribute it if it's able to populate through CAD. If you guys want to go down that path, that's something that you can definitely do. There's a bunch of other options, but yeah, if you have a team or already have an ArcGIS account, we can provide that layer, so you don't even need to log into FirstDo to access the information data, because it's all available within ArcGIS.
Great. Here's a good question about information sharing is, could this also be used for law enforcement and sharing with them since they also respond on 911 calls?
Yeah, absolutely. Any public safety agency, whether it's law enforcement, fire, Office of Emergency Management, EMS, they can set up accounts. We have focused pushing out to the fire department side because there was and EMS because that was the biggest need at the beginning, but we already have agencies sharing this with PD. If you sign up for an account and you want to share with PD, the process is really simple. Just reach out to us and say, hey, can we get an account set up for PD? And we'll do that as well. Really simple and straightforward. We are reaching out to all law enforcement agencies across the country this week as well. We've already reached out to all fire departments and all OEMs. And we're going to be doing more of that ourselves, but obviously the IAFC's done a great job in helping us bring a community together also.
Great. Do you have a way to connect with folks that sign up through the Community Connect to reach out to them and then do things like welfare checks or just touch base back with them?
Yeah, absolutely. So we're in the process of just making the Community user side of things available, so that that data can be, exported and taken out of the system if you want to put into your own mailing list and program. So if you just want to create a list of people with certain access and functional needs and put it into your own mailing list to send emails out, you can absolutely do that. So that's just a really simple way for you guys to say, hey, show me everyone who's potentially high risk that I want to send some information out to. The community service part to Community Connect and everything that you can do with it is really quite powerful. So yeah, that's something that you can absolutely do with this version.
Great. And maybe this question is for the chief, but what are some ways that you've seen that departments are using to get to the public and inform them about this?
Yeah, the social media has been our most effective. Probably right behind. We were fortunate enough to have a local media team that reached out to us, and we did a whole segment. That segment jumped our enrollment probably 50% easily. It jumped it a whole lot. So, but the frequent social media posts. One of the things that we have the benefit of is that we have 20 with the city, but 19 county fire departments that are around us. Each one of those departments are pushing out the information as well to everybody in our county, and so that was a plus for us. So one of the components of our media outreach has been, or is going to be, if a lot of our outlets touch outside of our county. And so what we're going to do is we're reaching out to the counties that border Buncombe County, and then we're going to push out this information, the free version, to them to be sure that everybody around us can self-report. But yeah, basically to answer the question, the social media pretty much has the biggest impact. We do have cards that we have printed that every fire life safety event, anybody who attends a fire life safety education event gets one of those cards, and it goes home. It goes home with them. So, and Rami, I didn't know if you wanted to chat. I don't want to open up a can of worms, but the really neat thing about Community Connect for us is it self-monitors. So the information doesn't go stale over time. At least for our platform, First Do, and the Community Connect, the way we use it, a person can register, put information in, and then after 6 months, they get an email to say, hey, is this information still relevant? And that for us is a huge deal, so that we don't end up 10 years from now with a lot of stale data. So I just wanted to throw that in. Hopefully I didn't
That's
there, Rami.
Dan, that's exactly right. And it's a really good point. And then just on the outreach, we will provide you guys a step-by-step guide on all the different ways that you can reach out to, similar to what we walked through today. You guys are going to have access to that in a little presentation. So internally, you can just walk through this and you'll have all the assets that you need as well. Thanks for running us through that, Dan. That was really helpful.
All right, Ron, we got a question here. They may have missed this, but they're saying that there's a free version and a paid version. And can you explain that, please?
Yeah, exactly. So First Do is kind of an end-to-end pre-incident planning, mobile response, and community engagement platform that's used by agencies across the country. There was never a free version of Community Connect, or there hasn't been in the past, of First Do as a platform. However, during this COVID-19 crisis, we realized that the Community Connect part of First Do could be very useful. So we created a free version of the solution, something that could be rolled out across the country and if not the globe very, very quickly. That would allow any agency to have people self-report COVID-19 related information as well as high-risk occupant information. It's the free solution is obviously a limited solution, doesn't include anything around pre-incident planning, integration to dispatch, your own area and all that sort of stuff. If you want more information about what First Do does outside of this free version, more than happy to connect after this call. But the free version is really meant to be something that we can get out to everyone very quickly. That's very focused around COVID-19 and how we can battle it. And again, we did that in partnership with the IAFC, technology partners like Esri, and just we all put our heads down in a very short period of time, got a solution together that can be rolled out to everyone very, very fast. So that's what that free solution of Community Connect is. Everything that you've seen today is the free platform. Everything that we're going to send to you is all part of the free solution. So just so you guys are aware.
Great. And Rami, a question too, a follow-up. So if a department needs help integrating your feature service that you're providing back out to their CAD or to a system that they're using, the way you structured it, you can connect pretty much to any CAD. Can you talk through y'all's experience already with dealing with different CAD companies?
Yeah, for sure. So a couple of parts to it. On the feature service side, that's really simple. We would just integrate that directly into your ArcGIS account. So we just provide it, just create a group and then give you guys access. That would be the simple way to do it. And then internally, that department and agency GIS team can do whatever they want with that layer. So that's one part. And they could then go take that layer and just put it into CAD via CAD map. There's a bunch of things that they can do. So that data is now, that public safety agencies to do something with. In terms of integration to CAD, yeah, we as a software company have been integrating with CADs. Every single one of our customers that's using the First Do end-to-end platform has an integration with CAD, and that integration is really straightforward. In many cases, it's as simple as an email, but we've done everything from API to real-time integration to just all the ways that you can imagine we've kind of dealt with. So for a lot of our customers who are using the end-to-end platform, not just the COVID-19 piece, we integrate with dispatch. So if there's anyone that wants anything different or outside of what this COVID-19 solution is providing, including integration with dispatch, pre-incident planning, feel free to reach out and we can talk to you guys about some options.
Great, thanks. I know a lot of departments might not do their own dispatching, and so they don't know a lot of the technical pieces that might have to go into a CAD integration. So I think the way that First Do is set it up, it makes it very simple and doesn't create a lot of extra work on that 911 center to bring that feed in and then push it back out to their departments.
Exactly. And Jeff, just to clarify one piece, because you're totally right. The integration can be as simple as, hey, send when a new incident is created, when units are dispatched, send the whole message to this email address, and then First Do does the rest. For most CAD systems across the country, that's a few-minute process for them to set up. So it's really, really straightforward to start getting calls coming into First Do.
I just wanted to add real quick. I know I don't want to get too far off in the weeds, but one of the things that the city of Asheville has noticed is a decrease in turnout times, because the way that we have it set up with our CAD vendor, it sends the alert to First Do before it sets the tones. And a lot of times our folks will be moving to the truck before the tones even hit. I know that's not on the topic of COVID and Community Connect, but that has been a huge benefit that we've seen within our fire department here in Asheville.
Thanks, Chief. That's good information there. Chief, you talked a little bit about the city of Asheville and the county departments around you. Are you guys all in one dispatch center, or is it separate and the data is going to both of those centers?
So we have, Rami can be able to talk about the behind the scenes part, but so our dispatch center is located in one building, but we have a city dispatcher and then the county dispatchers for ambulance and county fire. So we have three stations that are active. And so the way they've got it set up is if we go to in one of our county stations, we go mutual aid to one of our county stations, we see all of their pre-plans. We can't edit any of those pre-plans, but we can see those pre-plans. And conversely, when we have a fire in the city and we need mutual aid to come and just stand by and cover our stations, they can see all of our pre-planned data. So you can imagine we don't have too many big buildings downtown Asheville, but it may be something different from a volunteer station that maybe has a 3-story hotel. Well, we have a 19-story building. That if they respond to that, they have access to all of our pre-plans about that building, and so it's just been a huge help. But so yes, the behind the scenes, we're able to share the data across all of the counties within our fire. I can see all of their pre-plans, they can see all of our pre-plans, and the dispatch is separated so that I don't hear all of the county calls and the county doesn't hear all the city calls, but the information is there if needed. I hope that answers your question.
Great. Thank you, Chief. Go ahead, Rami.
So Jeff, and just one thing on that point, first to being kind of that enterprise data sharing platform has made this ability to push out COVID-19 specific solution just all that easier. What data we show, how we show it, the bidirectional integration with ArcGIS, all of that stuff was already set up. So it just really made it very simple for us to roll this out to everyone and really get that COVID-19 solution out to everyone's hands very quickly in a secure way.
Great. Kind of circling back to the COVID events that's happening right now. One of the things that, as we started talking about this with First Do, was that this is truly a life-saving tool. It's life-saving for our citizens. They can make the first responders aware that there's somebody in this residence or in this building that is suffering from symptoms of COVID or maybe has been diagnosed. But more importantly, it's making our first responders aware when they're going to these locations that there is a potential patient there that they need to take those universal precautions with. So I think this is truly a win-win situation back and forth, because it's taking care of both our communities, our citizens and our firefighters and EMTs. So I think that's really important to remember this. And as we talk to citizens about this and you go out in your communities to sell it, it's not something that we're looking to invade their privacy. What we're doing is to try and make sure that we understand what their needs are, just like if they were on home oxygen or in a wheelchair or things like that. Because if for some reason they haven't been seen in a day or so, maybe we need to send that welfare check out and have somebody go check them and make sure they're okay. Again, this has been a great webinar. Thanks for all the great questions out there. Let's make sure I didn't miss any. Nope. And any closing remarks there, Rami?
Yeah, Jeff, I thought that was a really good point. And, we've been doing this for a long time on the community outreach side, and we've seen a lot of agencies roll out Community Connect, and we've even started to do our own rollout of Community Connect COVID-19 across the country. And, people really want to help, especially at this time, really want to help their first responders. And if it's explained to them, which I think we're doing a good job of explaining to them why this actually makes a difference, why self-reporting your status, whether you're healthy, whether you're high risk, have access and functional needs, or you actually tested positive to COVID, why this actually helps fire, EMS, law enforcement, emergency management respond to them, and how it helps the community. People are really receptive and really excited to help out. So that's just the sense that we're getting. Times have definitely changed. People are banding together, and they're very interested to see how they can help in this time of need. So we have people registering across the country. So every single public safety agency, we're going to be reaching out to you to hand access over to you. So this, please, if you see an email from us, we know you got a lot going on. Just take the access so you have the data. And even if you don't reach out to community, if we have, we want to make sure you have that.
Great. Thanks, Rami. And again, thanks very much to First Do for bringing this to us and to our citizens. And remind everybody, visit the IAFC.org webpage to get the latest on the COVID information. And there's a whole lot of resources there for fire and EMS departments to use and share. Thank you very much for joining us today, and we'll see you on the next call. Thank you. Crazy. Jeff, once you voluntarily
Hey,
give
Rami, you
something,
still there?
I am. I'm just trying to. Some reason it's not allowing me to, and I'm just going to hang up the session. Is that okay?
What you see that little red dot for the recording? Hit it again, and when you see it, well, actually, oh, you made me the host again.
Yeah, exactly.
Okay, so I'll stop the recording, and then as soon as I stop recording, the event will end. So goodbye for now.
All right. Thank you.
Bye bye.